This podcast is hosted by licensed therapists, but it is not a substitute for therapy. The content is for informational and educational purposes only and does not constitute professional advice or a therapeutic relationship. If you are in need of mental health support, we encourage you to consult a licensed mental health provider in your area. I'm Dr. Marissa Eusebio.
I'm Dr. Anna Barus.
We are licensed psychologists and we're moms, but we are not your mother's therapist.
All right, welcome to our second episode of Not Your Mother's Therapist. And I think this episode, I was like, Marissa, what are you feeling really passionate about? I think we want to really focus on things that we're really passionate about in the moment. Mm-hmm. And what did you say?
The lack of education. That this is something that I will I think forever be so angry about and so passionate about.
Yeah.
Because we are reproductive mental health psychologists, mm-hmm. right? We've got this fancy term, and yet it took so much training outside of the years and years and years of grad school training and undergraduate training and all of our degrees and fancy letters after our names. And we still had to go to all kinds of trainings and conferences just to get any training on reproductive mental health.
Yeah. And I talk about this too. I know sometimes you and I have done trainings on reproductive mental health. Mm-hmm. And we'll often have a room full of psychologists, and I'll ask okay, so how many of you here ever heard the words perinatal, postpartum depression, menopause related, anything? And usually there's maybe, if I'm lucky, one person in a room full of psychologists, PhD level, that have ever heard those words in their graduate training. And then I'll ask, and how many of you have had patients dealing with any of the issues that I just mentioned? And the whole room will raise their hand.
Everybody's hands go up.
So what the fuck is going on there?
Mm-hmm. Yeah. I mean, I wish I knew, right? Because it's not only psychology, it is also the medical profession, right? Which in general don't have a lot of mental health training. Mm-hmm. But if you talk to the OBGYNs that we've worked with, their training has been next to nothing.
Yeah.
And they are OBGYNs, right? They work with patients with perinatal mental health concerns, postpartum mental health concerns, and their training is practically nothing.
Yeah.
And then they're relying on psychologists who most of us haven't had training in this, which is wild. Yes. And it just makes me so angry. Mm-hmm. And we are very fortunate that in the women's clinic that we have worked in, we got all kinds of grants and special funding to be able to take these trainings. Right. Because my goodness, are they expensive?
Right.
I mean, thousands.
But I will say, we had to seek them out.
That is true.
They didn't land on our lap.
Yes.
We were like, I don't feel like we have the tools to help the people in front of us right now. And then we sought them out and we got them. Right. Shout out to Postpartum Support International for providing these kinds of trainings. It's a great resource for moms, but also for providers that are wanting specialized training in this. We both went through the training, and also they have a directory of all the providers that have gone through the training. So if you're like, I need really somebody that is really focused on these kinds of issues, PSI is going to be your best bet.
Mm-hmm. Yeah. And it's really sad that we haven't had this training, or a lot of people in our field haven't had this training, because essentially what happens from there is that it has this trickle down effect to where if us as psychologists don't realize that this is an issue or something that we should be thinking about or asking about when working with our patients, then you all aren't going to know that this is something of concern, right? The number of times that I have worked with someone who said, I probably had postpartum depression with my first baby, but I didn't know what it was.
Oh, yeah.
And it's like, oh, gosh, that is so saddening.
Yeah. And the number of times that I worked with, before I had this training, before I was specialized in reproductive mental health, the number of times that I was doing trauma work and things like that, and dealing with a mom that might have been pregnant during the time or just gave birth. And I kind of just treated it as an afterthought. Mm-hmm. It's embarrassing to say now. Mm-hmm. I'd do a 5-minute check-in, oh, okay, so how's everything? Oh, okay, you're breastfeeding. Okay, good. All right, let's jump back into the trauma work that we're doing. Like she didn't just go through the most significant life change in her freaking life. Right. Yes.
And same with dads. There is a patient that I will never forget who came in with depression. This was before all my training, right before the women's clinic. And he came in with depression. And it was right after he had his baby. And everything that he was telling me about was essentially postpartum depression.
Yeah.
And I'm just sitting there over like, oh, I wonder why you're depressed.
Oh my gosh.
Not even thinking that it was directly tied to this significant life change that him and his partner just had.
Yeah.
And again, like you said, I look back and I'm like, damn, I'm embarrassed.
Yeah. And it's important for us to say this because there might be providers listening that are like, oh, maybe I've done something, that wasn't the most mindful thing to do with the patient in front of me. So have we. So have we. And to some degree, it's not your fault if you're listening. There's just really not a whole lot of training on this. I had a dad one time that was telling me that his wife had this horrible birth trauma. She almost died and stuff. And I was like, wow, is your wife doing okay? I never asked him, how are you doing? Almost seeing, his wife was out cold. He was awake, watching all of this happen.
Yeah.
And I was like, oh my God, is your wife in therapy? What about him? It's embarrassing now looking back. Yeah. So if you're a provider and you feel like, yeah, I've done some of these things, yeah. Welcome to the club.
Yeah.
It's not your fault, but it is on us to now seek out that training because there are a lot of training opportunities now. In the last several years, it's really, really been revamped a lot. So we're getting there, but we're not there.
It is very slow.
Yeah.
And I think a couple of things that we wanted to spend some time talking about today is what is postpartum depression? What are postpartum blues or baby blues, as people say? And what about the anxiety? So I think those are some of the things that are very important to us for people to know and have an awareness of.
Yeah.
Because in the postpartum period, it is completely normal that within the first 2 to 3 weeks, especially, for you to have a lot of mood changes, right? Yeah. And have a lot of symptoms that resemble depression, right? Things like fatigue. Well, hello, you're probably not sleeping. You just recovered from labor, right? And even mood changes, right?
Yeah.
You're feeling more irritable. You might have moments of sadness, right? But the very important thing for postpartum blues is that it lasts for 2 to 3 weeks.
Right.
And it affects 40 to 60% of moms, not just new moms, 40 to 60% of moms. But then it ends. And the other piece of postpartum blues or baby blues is that as you're experiencing it, the most prominent emotion that is still there, the common thread through all of that is still happiness.
Yes, that's huge. Yeah. And there are some studies that show that usually when you're testing for postpartum blues, postpartum depression, if someone, it's very common to experience these things as a new parent. But the difference you'll see is that if you just do a measured testing for those depression symptoms, then both depressed parents and not depressed parents will score high, right? But if you do a screener that includes both positive emotions like happiness, love, joy, all these things, then what you'll see is the non-depressed parents are going to score high on those positive emotions as well, whereas the postpartum depression parents won't. And that's how you can kind of tell the difference between the two.
Yeah. And I actually misspoke earlier. It's not 40 to 60% of parents. It is 40 to 80% experience these postpartum blues. And I will be so honest, I 100% was experiencing postpartum blues with my first, actually not with my second, but with my first. I will never forget, I'm sitting on the couch with a brand new baby. This is what I wanted. I was so happy to have a child. And all I could think about was how much I missed my old life. I missed my old life so much. I don't think I had mentally prepared for, and I don't know if you really can mentally prepare for this, but I didn't mentally prepare for the fact that my sense of freedom, especially in those early postpartum days, was non-existent in a lot of ways, right? I couldn't just get up and go.
Yeah.
And that was driving me crazy. I remember being in tears, and I called my older sister, who at that time she had 2 children of her own already. And I was like, help me. Am I this terrible mom? Did I make a mistake having a baby? What is going on? This sense of just feeling so much grief was so strong. And my sister was like, nah, that's normal. And that was the most relieving conversation I had in my postpartum period. And she was like, yeah, me too.
Yeah.
She was like, I have not met another mom who didn't experience something like that.
Yeah.
Right? Where you're just like, man, I just want to go to the grocery store. Like, I just want to go to the gym. I just want to go do something without like packing a diaper bag. Like, well, who's going to watch the baby? And like, when did the baby eat last? Because like, I got to feed him.
Yeah.
And just how mentally exhausting all of that is. And she was like, no, this is an adjustment to this postpartum period.
Yeah.
And to having kids, right? Because it is certainly a life adjustment. And that was just, I needed that in that moment. And that was absolutely, for me, part of my baby blues. And I'm very fortunate that it lasted just a couple of weeks. And and probably some sleep was needed there also. Because
Can I say something about those couple of weeks?
Yeah.
This might be a little controversial, but who came up with that 2 to 3 week number?
For postpartum blues?
Yeah.
I have no idea.
I just feel like I don't know how someone can say like after 2 or 3 weeks,
Yeah.
you should be good to go.
Because, actually, it's a good point because I do feel like one of the biggest contributors to postpartum blues are, one, the hormone crash, because good Lord, that is intense. That does last for like 1 to 2 years, but the initial like month or two is still really freaking intense.
Yeah.
Between that and you're not sleeping.
Yeah.
Like, of course I'm going to be irritated
Yeah.
at the sound of my husband chewing because I have not slept since I gave birth. Okay. And like giving birth is a whole feat in itself, right?
Yeah.
And your body is recovering. And we know what is the best thing for recovery? Sleep. What am I not getting in the postpartum period?
Sleep.
Right.
Yeah.
So, I don't know who came up with the 2 to 3 weeks. I don't know how they measured that, like what the research was in terms of measuring that time period. But 2 to 3 months actually probably sounds a little bit better to me.
Yeah.
But again, for baby blues, I think the biggest factor here is the positive emotions that you're experiencing. Because I absolutely had that especially with my first.
Yeah.
I was like, I'm struggling, but like, man, am I happy.
Yeah.
Man, do I love this little nugget.
Yeah, for sure. And I think this is where we get into the topic of when does it cross over into postpartum depression, right?
Right.
And I think one thing that you and I were talking about is like, well, maybe we can, guide the listeners to like how they can test themselves for postpartum depression so that they can seek help. And I think the conclusion that we came to was that if you even think that you need to pull up something to test yourself for postpartum depression, go ahead and just skip that and just call somebody.
Right.
So again, go to PSI or something like that to connect with somebody that's a specialist in this. Because chances are you probably do.
Yeah, absolutely.
What are some stats on postpartum depression that we have?
Well, for women, it is 1 in 5 women will experience postpartum depression. And if you have it with your first, you are more likely to have it with subsequent pregnancies or subsequent postpartum periods.
If you are lower socioeconomic status, you're more likely to have it.
And Black and Hispanic women are also more likely to experience postpartum depression, which is just heartbreaking. Like, come on, can we not do better for these women?
Shout out to the Black Infant Health Program.
Oh, yes.
Definitely look them up. If you identify as Black, they provide free mental health therapy. They provide a lot of free stuff. I think every once in a while, because we know of so many resources that really a lot of people don't know about, every once in a while we're going to drop something to say like, look up these people because they're doing good things in the community. So
what was the name again? One more time.
Black Infant Health.
Black Infant Health. I love it. Yep.
Yeah.
And, in the postpartum period, right, as we said, and I think our last episode, maybe earlier, it does not only affect women. And this is a hill I will die on. Like, this also affects dads.
Yeah.
So it's 1 in 5 women will experience postpartum depression and 1 in 10 dads.
Yeah.
And if you are a father and your wife, your spouse is experiencing postpartum depression, you're twice as likely to also be experiencing postpartum depression. And can you imagine that? Both of you are going through the postpartum period experiencing depression at the same time.
Oh my gosh.
And it does show up differently in men, right? Oftentimes it's more like disconnection, right? Like disconnecting not just from like the baby, but from like the family in general.
Yeah.
An amazing resource that we have both loved and used is the Center for Men's Excellence.
Yes.
They are awesome.
Yeah.
We have gone to one of their talks at a conference in the past.
Yes.
And they have amazing resources for men and for dads. And I can't stress that enough, how important it is.
Yes.
And I was leading a group one time where it was a group that we had for pregnant women. It was a support group. And I was talking about postpartum depression in men. And I had actually several patients that were angry. They were pissed off. They were like, what do you mean postpartum depression in men? Like, this does not exist. And
a lot of resentment for dads.
So much resentment. Yeah. And they felt like, and this I do understand, they were like, almost like, this is ours. Like, why is this also something that you're struggling with? And I don't have an answer for that. But what I can say is men experience this. And if that makes you mad, you can stay mad. But like, I will die on this hill that fathers also need support. They need help when it comes to postpartum depression and this phase of life adjustment, because it is not fair to just be like, well, you got to figure it out.
Right.
Like, sure, they're not the ones who are recovering. They're not breastfeeding. They may be not getting up with the baby or as much with the baby, right? But how do you expect them to support the ones who are doing all those things if they are also depressed? Like, come on, this has got to be a more like centered approach. It's not just us. It's not just the women that are experiencing this.
I had some dads contact me wanting to start therapy, and there was one time where I was like, I was full, I couldn't take on anybody else, and so I was like, man, I don't have any availability for a while, but I'm going to connect you to all these resources. And when I tell you that he was so incredibly thankful, he was almost in tears, like, because it was so hard for him to find anybody that even cares about dad's mental health. And then the fact that I went above and beyond and I connected him to the Center for Men's Excellence and all these things, like, he was just so thankful that other people were even doing this. And there's been a few times where I remember the first time I was like wanting to connect one of the dads that I was working with some kind of like dad support group. I was like, I'll connect him with a dad support group. And I was just like, I'll just type it in on Google and I'll just send something. And turns out there are so little dad support groups out there. I maybe found one that was free. The other one costs money in the entire nation. And God, I hope that's changed since I looked that up like 2 years ago. But they are very hard to find. PSI is one of the ones that offers the free dad support group, but they're, one of the very, very few. And I think I mentioned this in our last podcast, but I think with how involved dads are today, the amount of support that they're getting is not equating to the amount that they're doing.
No, it's not.
Yeah,
they're doing so much these days, right? And again, they have to be healthy themselves to support us who are physically recovering, emotionally recovering from pregnancy and labor and all of that. And me and my husband were very fortunate that he was not experiencing postpartum depression. And God, am I thankful for that? Because when I had my first and I was going through like postpartum blues, I remember that he came to me one day and I was maybe 3 weeks postpartum. And he was like, I feel like you should go get a coffee. And at first I was kind of offended because I was like, well, you always go get, like, if we're getting coffee, you usually go get it. Like, why are you making me go get the coffee? Like, excuse you. But he was like, no, you enjoy driving. It's a beautiful day. He was like, go get a coffee, hang out at the coffee shop. Or he knows me very well. He was like, sit in the car and listen to music, because that's what I do all the time. I just sit in my car and I listen to music. Like when I pull into the driveway, if there's a good song on, I'm staying in the car. If then there's another good song on, I'm still going to stay in the car. So I might be here for a while. So he was like, go, just take your time. You just fed the baby. He's good. I'm good. Go.
Yeah.
And I was like, all right, whatever, I'll go get the coffee. But like, this is not really going to do anything. And when I tell you that was like the most memorable 30 minutes of my postpartum period, like this was now 3 years ago. And I still remember this moment and how much I enjoyed it. But if my husband had been experiencing postpartum depression, he's not going to be able to think and have the mental resources to be like, okay, well, what does my wife need? What does she need right now? And how can I make her feel comfortable with leaving the house, right? Baby's good, baby's fed, everything is good here.
Right,
go
because
and take
they have
your
their
time.
own needs.
Exactly.
Yeah. Why do you think it is that we, as providers in the mental health field, are not trained on this?
I mean, I think we could go through a really long history of women's health just not being important at all.
Yeah.
I think
or
that's
normalized,
shifting. Or
right?
normalized.
Like that's normal. Oh, you're struggling.
Oh, that makes
that's
me
normal.
so mad.
Yeah.
Talk about things that we're pissed off about.
Yeah.
When you just assume that a postpartum mom is always going to be incredibly tired, like, come on. Of course we're tired, but that doesn't mean that you don't help a patient, help someone figure out ways to get more sleep or to get more rest.
Yeah.
They just kind of say like, oh, okay, you're postpartum. You're not sleeping. I actually spoke with a patient once who I did not work with her when she'd experienced postpartum psychosis, which is a whole other thing.
Ooh, yeah.
But she had experienced postpartum psychosis, and she was telling me that at the time she was not sleeping. And she told her providers, I'm not sleeping. And they all were just like, it's normal. It's normal. You've got a baby. You're not sleeping. And because they all thought it was normal, nobody asked the questions about, what do you mean you're not sleeping?
Right.
Because it was not just, I'm waking up with the baby during the night. It wasn't just, I'm sleeping in these chunks and then I'm having a hard time going back to sleep. She was not sleeping.
Yeah.
Like, she would put the baby down. She's awake until they wake up again. She feeds them. She's getting maybe 30 minutes of light sleep here and there. And that triggered postpartum psychosis. And, you know, not everything is preventable, right? But had someone asked her, what do you mean by, oh, you're not sleeping? Tell me more about that. Then this could have either been prevented or it might not have been as severe, right? And she would have, in the very least, gotten the help that she needed sooner.
Right. Yeah.
But we're not asking the questions because so much of this shit is just normalized.
Right.
And it's almost like we are expected to be miserable in this period. And you do not have to be miserable. It's hard.
Yeah.
It's challenging physically, mentally, emotionally. But there are more support and there are ways that we can support you.
Right.
But providers aren't trained on it. And so they don't know how to help people.
Yeah, and I think it's important to mention, too, that psychosis and postpartum is always a mental health emergency. It is an emergency.
Yes.
Meaning that this person needs to be driven over to the ER. You need to call 911, especially if there is some kind of threat to the baby, right? I'm having thoughts about harming the baby. Big red flag. Big red flag. This is not a phase where you want to be like, oh, yeah, it's normal. It will pass.
No.
Please go to the ER. It's not normal.
Yeah. And actually what's wild is that I don't know how long I'd been working in the women's clinic, at least a year, if not 2 years, before I actually knew that.
Yeah, I know.
Now, postpartum psychosis is extremely rare. It is 1% of the population. So it's very, very rare, but it does happen.
Yeah.
And I had no idea that it's a medical emergency. And I'm over here like, I'm a reproductive mental health psychologist. I know things. Apparently, I didn't know some really big things.
Right. This isn't a situation where you thought challenge. Well, you pull out cognitive behavioral therapy and like, well, let's look at,
Let's talk about this.
Yeah, no. Go to the ER. Like it's an emergency. If there's a provider listening, just so you know.
Yes.
Yeah.
And now we've talked about baby blues, but what distinguishes postpartum depression from baby blues?
Right. So if it's lasting more than the 2 to 3 weeks for baby blues, right, and if it goes on for longer than that, then it's probably crossing into the territory of postpartum depression. So if it's been like 2 or 3 months and you're still struggling with some of those symptoms, then, you know, and you can look up the symptoms as well. You know, you can just Google it. It's everywhere now. But if you're still struggling or if it feels like motherhood is just like way harder than you expected, I don't know. It's always harder than you expect. But I mean, you know, if you feel like you're struggling with it, then, and if it's lasted a while, then it's time to probably talk to a specialist. And in that, there's a lot of different therapies that are really great out there and research supported, interpersonal therapy. You know, we do a ROSE program for the prevention of postpartum depression. So there's a lot of cool things out there. And people that are specialized in this.
Yeah. They're few and far between. There's less people that are specialized in this than what we would like, but they are out there. They are out there.
Yeah.
And, you know, hopefully the field is changing a little bit because I think we're recognizing more and more that people need help and people deserve help. Parents deserve help and to feel good about parenting and to feel good in postpartum.
Right.
You all deserve this.
And I mean, I think there's quite the wave today of people not wanting kids. That's kind of a common topic today.
I get it.
Yeah, I mean, it is hard to be a parent today in America. And so if it's feeling hard, it's because it probably is. And it's hard for everyone. And I think that's part of why we're so pissed. That's part of why we even started this podcast, is because there's for all the stuff that we know, right? We're reproductive mental health psychologists. It feels like the system at large is working against us in the therapy room, right?
Yeah.
When, reproductive rights are being taken away and those kinds of things, it's just like, it's exhausting.
It's exhausting. I will never forget that during our residency or internship? I think it was during our residency. We gave our first talk about perinatal mental health, postpartum health, and that was 2 other psychologists, right? And after that talk, after that presentation, we were just inundated with people saying thank you. And I was so taken aback.
Private messages. People privately messaging us separately.
Yes. Yeah. And I was so taken aback because I was
very surprised.
I'm this resident who I feel like I don't know anything yet. Right. I'm just giving this presentation on something that I kind of know about, but I'm not, especially at that point, nowhere near being an expert. And
they were meaningful is what it was.
Yeah.
It wasn't like, hey, great job. No, it was like meaningful.
From these psychologists who have been in the field for years, for so long, people that I looked up to and still do is look up to, respect. I'm like, you all are training me, but this is an area that you don't have experience in or not training in. And people were saying to us, I see patients that are experiencing these things on a regular basis. Yeah. And was just kind of doing what I always do with patients, which is still good work, but not specialized in this way. And there was such a big gap in their knowledge that I will never forget that. Like, man, this is so sad that all these well-experienced psychologists didn't know a lot of this.
Yeah. Yeah. So what's our call to action, you think? I think I have one.
Oh, what's yours?
I think if you are someone that feels like you're struggling with anything reproductive mental health related, perinatal, postpartum, menopause, any of these things, then PSI, right, is a great resource to actually find providers on there that are specialized in this, that are going to do evidence-based treatments for this. But if you're a provider and if you're a prescriber too, it's especially important to go on PSI and get that training from there. Prescribers especially, oh my gosh, when it comes to when I'm working with a mom that's really struggling and needs to get on some kind of medication for something and they're lactating, it's a whole thing. And I'm the one that has to figure out, I'm like, hold on a second. Who's the prescriber that you're working with? Are they specialized in reproductive mental health? Because if they're not specialized in reproductive mental health, it's a whole thing. They will take them off their medications that they had no business taking them off of. Or they'll be like, oh, you can't take this because you're lactating. Or they'll give them things and the mom will be like, my milk production has gone down significantly. Is there another medication we can take? Or it'll be like, I know that the medication is having an impact on my baby. I can see it.
And the prescriber's like, man, are you sure?
And the prescriber's like, it's probably okay.
Or stop breastfeeding.
Yeah. Or stop breastfeeding.
What?
Yes. Yeah. So prescribers too, they have a program there where you can get trained also.
Well, I realized you asked me first what the call to action should be. And now I'm like, damn it, what is going to be mine? But then I asked you what yours was. So now I'm like, God, I don't know. My call to action would be, I think, to look at the groups on Postpartum Support International. Look at the trainings, look at the website, but I want you to go look at the list of groups.
Therapy options.
Because let me tell you, you go into, so it's PSI is Postpartum Support International, postpartum.net. And when I tell you they have groups for everything, family-related, for dads, military, veterans, women, trans,
Some of the ones that I can even think of is Military Moms Connect, Black Moms Connect, NICU parents.
Yes.
If you previously had a miscarriage and are now having another baby and you're anxious about that, there's a group for that. And they're free. And they're like 90 minutes virtual. So if you have a baby and you're like, I can't get out of the house, this is virtual. You can attend. You can usually attend with your baby too. And you just register. That's it. There's really no catch to it. Like you just kind of register.
So go look at those groups. And I also realized that we were wrapping up this episode. Yeah. But I'm going to go on like a 45-second rant.
Go for it.
Because I'm sitting here and I'm like, you know what we haven't freaking talked about? That of all the things that piss me off about what we're talking about today with the lack of training, we have not once mentioned that there is no training on LGBT families.
Oh,
Zero.
No, zero.
So like not only is there very limited training on reproductive mental health, trainings that we had to seek out, even in those trainings, we're not talking about LGBT families.
We'll have to do an entire episode on this at some point, yeah.
Exactly. But it's just like, what the fuck? Why?
Yeah, why?
Why are we not talking about this? Why are we pretending like it's not extremely challenging to be a gay couple going through the adoption process?
Yeah.
Or when you drop your kids off at daycare and they're like, oh, well, where's the child's mom? Oh, like, is your wife coming? And it's like, no, we are their parents. Yeah. Or whatever other stigmas you're experiencing. I have two very good friends that went through the whole fertility process, right? And because of insurance things, they actually had to go to a group that was for parents who were experiencing infertility. Yeah. And it was a support group for them as they're going through the fertility treatment process. And my friends are sitting there and then it's like gets to their turn, like, well, why are you here? And like, well, because we're gay. Like, we're not experiencing fertility issues. We're actually just gay. So thank you for your time. We're sorry that you all are going through this, but we actually are just trying to have a baby. Gosh. And for some bullshit reasons, they have to go through all these hoops. And it's just like, this is silly. And I can guarantee you that this is contributing to mental health problems in these families that should not be there, but then also that we are not trained in how to support them.
Right.
So thank you for listening to my little rant on this. And I wish that there was more training that we had, but I mean, maybe this is the start of changing the field.
This is definitely the start of changing.
There's nothing out there, so let's change that.
I'm glad we're doing this.
Yeah, me too.
We're pissed enough to want to educate people about these kinds of things. And our next episode is going to be on dads. Yes. Probably one of many episodes because it is a very complex topic. It's not just like, we'll just give a shout out to dads really quick on one episode. No, it's not that simple. No. It's a very complex topic and it deserves multiple episodes. So we'll sporadically do different topics on dad issues.
And I'm very excited for that one. Yeah. It is long overdue and it is much needed. So I'm excited for that episode.
Yeah. From a mom's, like we are, it's not just dads supporting dads for once because those are the only people supporting dads usually. It's moms supporting dads, and that's important.
Yes. Well, thank you for listening to episode 2. So exciting. Of Not Your Mother's Therapist. You can find us on Instagram and TikTok at Not Your Mother's Therapist Podcast. You can email us if you want to say hi for whatever reasons, or if you want some of these resources that we're shouting out. If you're like, what was that one thing that you were talking about? Please email us. We would love to give you all of these resources. Not Your Mother's Therapist Podcast at gmail.com. And of course, you can find us on all of the podcast streaming apps.
Yeah.
Thank you all for listening.
See you next time.
This podcast is hosted by licensed therapists, but it is not a substitute for therapy. The content is for informational and educational purposes only and does not constitute professional advice or a therapeutic relationship. If you are in need of mental health support, we encourage you to consult a licensed mental health provider in your area.